Hi, my name is Jennifer Cutler, and I am in the CRNA DNP class. I live in Lancaster County, Pennsylvania, and I will be doing clinicals and working at Lancaster General Hospital after graduation. Lancaster General Hospital, also known as LGH, is a 525-bed hospital located in Lancaster City, Lancaster, Pennsylvania. LGH is part of the Penn Medicine Health System. They have a wide range of outpatient and inpatient services. They are a level 1 trauma center and a certified thrombectomy capable stroke center, and the only hospital in Lancaster County with this advanced stroke certification. LGH is located in Lancaster City, Lancaster County in south central Pennsylvania. Lancaster County has a population of 560,518 souls. It is predominantly white at 84.42%, and out of the 424,860 adults, 104,082 are seniors. In 2023, Lancaster was named the #1 place to retire in the U.S. Lancaster County draws retirees due to our abundance in senior housing, our close proximity to areas like Philly, Baltimore, New York, and DC, our climate, and our comparatively low cost of living. Lancaster is second in Pennsylvania counties with the most senior living retirement homes with over 35 of them. Lancaster County is predominantly rural, and the city's population is 57,970, which means over 502,000 people live in the suburban or rural parts of the county. One of our demographic that makes Lancaster unique is our Amish or Plain Sect community. The Pennsylvania Amish community in Lancaster is the oldest and largest Amish community in the United States, and as of January 2024, we have an estimated Amish population of around 30,000. Lancaster County's top 5 causes of death in order are heart disease, cancer, stroke, unintentional injuries, and Alzheimer's disease. Stroke in the elderly population and unintentional injuries in the Amish are 2 issues that I will discuss in further detail. It's important to recognize the larger senior population in Lancaster due to their high risk for strokes. One of the larger populations of people we see at LGH are patients with strokes, and since LGH is a stroke center, the surrounding facilities in Lancaster will transfer patients to us for evaluation treatment, such as thrombolytics and thrombectomy. In 2022, stroke was a leading cause for hospitalizations in Lancaster County at 34% of the hospitalizations, but stroke was only 6% of the causes of death in Lancaster County. Lancaster and 7 other surrounding counties right around Lancaster have the highest incidence of stroke in Pennsylvania. There are many modifiable risk factors and social determinants that can contribute to a person being at risk for stroke. According to LGH Community Health Needs Assessment, the top 3 health indicators for Lancaster are high cholesterol, which is 33.5% of the population affected, high blood pressure at 31.5%, and obesity at 31%. So any one of these risk factors alone can cause a stroke, but many of our patients have 2 or even all 3 of them. That puts them at a very high risk. LGH also identified in their health needs assessment insurance coverage, health literacy, and healthcare navigation as priority health needs. So these are issues that can also contribute to strokes because without insurance coverage, medicine appointments and screenings can't be affordable. Health literacy is an issue due to patients not understanding their modifiable risk factors or the importance of follow-up care or even understanding their risk at all. Navigating health systems can be confusing, and this also leads to patients not knowing their options to get help. As a CRNA at LGH, I will manage care for these patients. When a stroke patient needs interventional radiology for thrombectomy, they may also require anesthesia and intubation, depending on their condition. When a patient arrives to the ER as a rule-out of a stroke, the decision to give a patient thrombolytic or do a thrombectomy is made within just minutes. So there's little time for delay of the case to gather information. So depending on the patient's condition, past medical history might not be able to be obtained. It's important to identify common comorbidities that accompany stroke patients that we would need to know, such as high blood pressure, diabetes, and kidney disease, as well as any medications they're taking. It's important to get a baseline neuro exam and determine if the patient has the ability to cooperate, if they can lay flat, and if they can be still and protect their airway. Patients that are overweight or have sleep apnea, they also may benefit from general anesthesia versus just conscious sedation. These decisions, they need to be made if the patient will tolerate the procedure with local anesthetic to the groin and conscious sedation, or if the patient would need general anesthesia and intubation. These would be discussed in collaboration with the neurointensivist who is also doing the exam or the procedure. Other factors that contribute would be the patient's GCS and if they're vomiting. These patients going under these procedures, they also have risks that we need to monitor as a CRNA inter-procedure, such as intraventricular hemorrhaging, hypotension, or cerebral artery perforation. Also, a serious condition that occurs in about 5% of these patients going under these procedures, especially if they don't have an ET tube in for airway protection, is angioedema after receiving a thrombolysis. So there's a high risk for patients taking ACE inhibitors and also receiving thrombolysis for angioedema. So this is why it's very beneficial to know the patient's past medical history and medications pre-procedure due to things that can cause hyper or hypotension, or if the patient was on an aspirin type medicine, maybe they'll need platelets intra-procedure, or if they have kidney disease, and they might have issues with excretion of the anesthesia meds. We also would need to know if they're diabetic, because if they have low blood sugar, especially during the procedure, these can mimic stroke symptoms that can create that you're concerned, are they having a worse stroke, or if they're hypoglycemic. There's many concerns for residents in Lancaster County that put them at risk for a stroke, and ideally decreasing those issues will decrease the incidence. But LGH is also well equipped to manage and limit the sequelae of stroke complications. As mentioned previously, Lancaster County has a large Amish population. The Amish tend to treat illnesses and disease with herbal remedies and at-home treatments, but they will seek out modern medicine when warranted. Franklin and Marshall College did a health needs assessment on Lancaster County Amish. Overall, they are healthier than the English residents of Lancaster. That's what we call non-Amish people. But this is also self-reported. So the Amish, they don't have electronics or social media. So F&M, they did this assessment by sending out surveys in the mail, and results are dependent on the replies of Amish sending them back. And Amish do tend to also downplay their illnesses. Amish tend to go to doctors that are well known in their community, or they will even travel pretty far for practitioners that help cater to the Amish. They are also known to use chiropractors and practitioners that use holistic medicine, who also don't cost as much as traditional medicine. Amish pay in cash, and even though their church helps pay the bills, they still seek out for less expensive alternatives. Midwives are common practice, and several Mennonite birthing centers in Lancaster County are used heavily by the Amish families. At Lancaster General, there's a general practitioner that's an ex-Amish. He speaks Pennsylvania Dutch, which is their native language. Even though they do speak fluent English also, they're kind of distrusting of English medicine, so this particular doctor does really well with their Amish patients. Amish do not drive vehicles, they only drive horse and buggies, but they do rely on paid drivers to get them to their appointments. It's also common practice that Amish children are not vaccinated, and of those that responded to the survey that F&M did, only 18% said their children were vaccinated. The Amish also have a high prevalence of children born with genetic diseases, and many of them are unique to plain sect community only. The genetic diseases have developed over the years due to their initial small founding population and cultural isolation. So currently, Lancaster County Amish can trace their lineage to just 80 ancestors in the past 250 years since its founding. So that was interesting. We have specialized children's clinic in Strasburg that was started by Dr. Morton Holmes. It's become a world-renowned for his diagnosis and treatments of some of these specialized cases. So Dr. Holmes discovered the genetic disorder called GA1, which is a metabolic disorder that leads to a buildup of deadly acids in the blood, and this causes strokes or locked-in syndrome in Amish children. He also discovered maple syrup urine disease. This is another metabolic disorder where the body cannot process certain amino acids, causing a deadly buildup. So plain sect children were dying from this disease, and Dr. Morton discovered its cause and its treatment. So the death rate was about 60% for maple syrup urine disease, and the clinic has eliminated death rate altogether. So it doesn't mean they're not Amish children with these disorders, they're just not dying from them, and they have very specific diets and medications that must be followed or relapses do occur. Over 50% of Amish are farmers, and children start working on the farm at a very young age. Farming accidents are very common in Lancaster County, with Amish being our biggest farm accident type patients. Unfortunately, children are most likely to be killed in farm accidents in Lancaster County. Lancaster County is the state's leading agricultural producer, and it also has more farm-related deaths in the last 20 years than any other county in Pennsylvania. Other things seen in Amish culture is stoicism with pain and emotions. Children will look to parents before speaking to medical personnel. Children usually do not speak English, usually until after they're 5 years old. They only will speak Pennsylvania Dutch until then. Most education ends for them at 8th grade, and they receive that in a one-room schoolhouse. They have large families with multiple children. Though patients can make decisions in healthcare matters, the husbands usually have the final say in most decisions, and even they will seek counsel from elders from the church on some of the more expensive procedures. They do not have electricity in their homes. They're very modest in their dress. Women have their hair up under bonnets, and married men grow long beards. They refrain from pictures of their faces, and they do not use government aid or insurance. So they're self-pay. The church, we had discussed, helps pay with medical expenses. They have also been known to travel to Mexico or other countries looking for alternative experiments or lower cost healthcare treatments. The elders and their infirmed are cared for by their families in their home. The health needs assessment identified key issues for the Amish that caused delayed health care. And these issues were things were too expensive, they were unsure where to go for health care, they could not make an appointment, the office or clinic wasn't even open, they didn't have any transportation, or they didn't have child care, or they didn't like how they were treated. Lifestyle, religious beliefs, genetics, and even environmental concerns all impact Amish health. Healthcare literacy and preventative medicine are issues with the Amish population. I see Amish patients in my current role in the trauma ICU, and I will anticipate seeing them in my future role as a CRNA at LGH. Amish do have routine surgeries that are planned, so prior to surgery, medical issues can be addressed, so that as herbal treatments and supplements that are used, it's important to plan for appropriate cost-saving measures, treatments, and medications. Timing is important due to transportation issues. Patients with scheduled procedures would prefer early times for outpatient services so they can plan rides and not risk an overnight hospital expense that can occur with later OR times. It will also be common to have the opportunity to manage patients that are urgent or they come in as trauma patients. Since LGH is a level 1 trauma center, all patients in Lancaster County with traumatic injuries come to Lancaster General. Discussion with parents of pediatric traumas are important to discuss genetic abnormalities and special needs. Children that are ill will need to be checked for illnesses that can be contagious due to lack of vaccination. It's important to maintain their modesty while prepping them for pre-op and in the operating room. And I know from working in the trauma ICU, it's difficult taping the ET tubes around the Amish men's beards, but it can be done, and it's important that they are not shaved. It's important to ask very specific questions about herbal medications, pre-op. They will not offer this information freely. It's also important to monitor vital signs pre-op and post-op for signs and symptoms of pain, because they will not ask for pain medications. Our Amish patients are a very unique set of people, but getting to know their culture and earning their respect can be so rewarding. Thank you for listening to this presentation about Lancaster County and Lancaster General Hospital.